Welcome to East Baton Rouge Parish, home to Louisiana's capital city and nearly 450,000 people. The demographics of the parish are split almost evenly between Caucasians at 47% and African Americans at 45%. But perhaps the most interesting aspect of the parish's demographics is its poverty rate. A full 20% of its total population falls below the poverty level. The level of poverty within the parish has a major impact on the relative health of its residents. For example, more than 25% fall in the lowest level of health literacy and are unable to understand basic health information. Nearly 20% are uninsured, 33% are obese, almost 20% are smokers, and more than 10% are diabetic. To help combat these major health issues, Mayor Kip Holden developed the Mayor's Healthy City Initiative, also known as Healthy BR, in 2008. With the goal of helping to better coordinate different health efforts going on across the parish, today the initiative operates as a 501c3 nonprofit with more than 70 organizations under its umbrella, including hospitals, nonprofits, businesses, schools, and governmental bodies. It was through this initiative that the groundwork was set to reinvent the way the Community Health Needs Assessment would be conducted.
What's different about the Community Health Needs Assessment is that it's a collaborative process. We are one of the few communities where we have a joint Community Health Needs Assessment where 5 competing hospitals agreed upon a single population, the greater Baton Rouge area, and we came together with a joint Community Health Needs Assessment and a joint implementation plan that we all participate in and give our data and information to. As I stated earlier, our Community Health Needs Assessment identified 4 primary areas of focus. There were 10 major health priorities across our entire community, but the 4 that we focus in on from a community perspective are HIV/AIDS, mental and behavioral health, obesity, and overuse of emergency departments, which is a moniker for access to care. For many of these, there were many efforts that were already underway. For example, to support the efforts around obesity, we participated in the creation of the 5210+10. This has taken Michelle Obama's Let's Move campaign and adding the critical component of 10 hours of sleep. This message has been taught to more than 11,000 children each year and encourages them to eat their 5 servings of fruits and vegetables a day, spend 2 hours or less in front of screens, to spend 1 hour or more moving around, and consuming no sugary sweetened drinks. And of course, what's important, to get 10 hours of sleep each day.
Over the next 3 years, we'll be evaluating the results of our work in conjunction with researchers from across academic institutions. This will include looking at broader term population health metrics to look at overall trends and interim progress measures to evaluate the effectiveness of our programs and interventions. At the end of the day, it takes a whole village to care for the people who make up that village. And by using a collective impact model in Baton Rouge, we are finally achieving impact on some of our city's most persistent negative health outcomes.
The Health Needs Assessment team has already begun to see some very positive results from this collaborative approach, including reducing adult obesity rates by 2% since 2014, reducing preventable hospital stays by 4% in the past year, and achieving nearly 400,000 encounters in 2015 in Healthy BR supported programs.